So during the last ECHNO, we discussed about the quality of life in head and neck cancer patients. And we had several questions behind. The first one was if we were able to differentiate the quality of life according to the tumor viral causes. And we demonstrated that there is a completely different pathway of quality of life in HPV positive as compared to HPV negative cancer patients that have different scores at the beginning, different type of toxicities and so on, different quality of life during and after the treatment. So this was just one of the important topics that we dealt about. The second topic was the fact that if quality of life is only a mix of subjective patient characteristics, attitude, expectation, or if there is a link with the underlying biology. And we clearly showed that there are specific pathways, both in the central part and at the periphery, that causes changes in quality of life, and that they are directly influenced by cytokines produced by the tumors or by the treatment itself. So quality of life is just an epiphenomenon that has got a strong molecular and biological pathway below it. Then we discussed about the importance of quality of life in clinical trials dealing with head and neck cancer patients. And we had an overview of many trials that are ongoing or recently published where quality of life was the primary endpoint. So there are more and more trials where quality of life has become one of the most important part to be evaluated. Just to think about some de-intensifying trials where the importance is not just the overall survival, but the type of survival and the type of toxicities that the patient are experiencing during the treatment itself. So we spoke about the ECHN 002, we spoke about the ECHNO Cancer Research Group 3311, we spoke about the Orator trial, the Pathos trial, so many trials in particular in the intensifying trial with HPV positive treatment. And then we discussed about the fact that there are somewhat criticism about assessment of quality of life. Someone says that there are too many questionnaires. This can be true, but the other side of the moon is the fact that if you have many questionnaires, you may choose among different questionnaires to pick up the one that you prefer when you are trying to adopt a specific questionnaire for your patient. So this is another part. The positive aspects of the heterogeneity of quality of life assessment. And then we concluded this assessment about the importance of persisting in measuring quality of life. There are many trials showing that quality of life is prognostic since the beginning, and it keeps this prognostic value even if when compared with other prognostic factors like performance status, stage, or age. So please assess quality of life because it is a strong tools to better tailor, to better identify the prognosis of your patient. So having kept all these things in mind, we think that we have to build more and more trials and more experiences and more clinical research in quality of life of head and neck cancer patients throughout all the phase of the treatment. So at the treatment start, during the treatment, and in the survivorship phase. So this, I think, it's the main message coming from this discussion of quality of life during the ECHNO 2023.